We're live. Welcome back to blackdoctor.org, where wellness and culture connect. I am Dr. Cordai Decoto, board certified podiatrist, fellow of the Academy of Foot and Ankle Surgery, and podiatrist for Neighborhood Health, a federally qualified health center in New Jersey, providing care for all, regardless of immigration status or insurance. I am also the co founder of Sisters in Podiatry, a Facebook focus group for Black women in podiatry within the United States and the Caribbean. Woo! And host of your show, Stepping Forward with Dr. D, your gateway to all things of the lower extremity. So grab your favorite beverage. You know we spilled the tea and get ready. This is a special episode because December and January I'm a member of the illustrious ladies of the Alpha Kappa Alpha Sorority Incorporated. And it is my pleasure as we do the Divine Nine and our contributions to podiatry. And I'm so glad that these colleagues and friends could come on tonight and represent their organizations and spill a little tea on what we do. We're everywhere you want to be. And wherever you're hailing from, you know what we do. Put it in the comments so we can shout you out. We love doing that. And if you're a member of the Divine Nine, put your organization. So please give me a little bit of credit. I've had a little bit of problems today with my computer, so you'll see maybe a little technical issue, but we're going to get started. So give me 1 second, my loves. All right. I'm going to introduce our first guest, and I'm loving it. Dr. Kimberly Thurmond is a 1992 honor graduate of what? Which HU? Hampton University, and a 1996 graduate of the Temple University School of Podiatry. She completed her surgical residency in Buffalo, NYC, and at Western New York VA and Sheehan Memorial Hospital. She has worked in various clinical settings for the last 25 years, and like myself, is pleased to provide care at a federally qualified health clinics in Boston with a special emphasis on the diabetic foot care. She is also a certified wound specialist, providing lower wound care with the wound care team weekly. She is a silver star, which for those who don't know what that means, 25 years in the sorority. Like myself, I'm 28 and a life member of the Alpha Kappa Alpha Sorority Incorporated, initiated in 1993 in Zeta Psi Omega in Augusta, Georgia. She's an active member of Psi Omega chapter in Boston, Massachusetts, where the Pink Well during, of course, all the lovely events on Martha's Vineyard happens. And she's had multiple positions in the sorority within her 31 years and is currently the vice president of the Boston Pearl Foundation, as well as, like myself, a part of the North Atlantic Medical Regional Team. My dear co administrator, welcome.
Thank you, my dear Soror Doc. Happy to be
I
here.
love that you're here. We about
Thank
to
you.
do this. We're about to set it off. So let's get started. And I'm going to take
Let's go.
myself off of camera here. All righty. Who's going to be the next guest? You know what? I'm going to try to go in order of sororities, fraternities. So I'm going to go to my brother, Darren. Darren. And I
Hey,
haven't seen Darren since graduation. It's such a pleasure. And
thank you for
Darren is a native of Southeast Louisiana. He received his early education in his hometown of New Orleans, graduating from where? Southern
Southern
University
University.
with a BS in biology in 1992. He completed his medical training at my school, alma mater, the New York College of Podiatric Medicine in New York, and then returned home to complete his surgical residency in Lakeland Medical Center in New Orleans. Following his formal training, he went into private practice, founding the Bayou Foot Care. And he has been practicing in the New Orleans metropolitan area for nearly 15 years, specializing in diagnosis and treatment of a variety of foot and ankle problems. His congenial bedside manner and caring approach are both cited by his patients and caregivers alike. He's endeavored to bring the latest treatment options to Southeast Louisiana and is committed to treating podiatric medical conditions of the foot and ankle. His clinical pursuits include treatments of sports and running injuries like plantar fasciitis, fallen arches, flat foot, orthopedic trauma, neuromas, and more. And he is an esteemed member of the first D9 organization, the Alpha Phi Alpha Fraternity Incorporated, and my brother. And we are so happy to have you, Darren.
Thank you
Welcome.
for having me. Thank you, guys.
So who we gonna do next? Who are we going to do next? We always do the ladies. My sister, Dr. Lorraine McKinney. Dr. Lorraine McKinney is a native Texan. All y'all Southerners, I love it. She
Yes,
graduated from where? This is like HBCU week right here on the
that's right.
show.
That's
Prairie
right.
View A&M.
Yeah.
And my alma mater, or our alma mater, the New York College of Podiatric Medicine. She
Yep.
completed her residency at McGuire VA Hospital in Richmond, Virginia, and remained there to practice some years. She's later relocated to where? Houston, and has continued to serve podiatry to the needs of the greater Houston area for over 20 years. She's board certified in prevention and treatment of diabetic foot wounds and in diabetic footwear, and the American Board of Multiple Specialties in Podiatry, and currently is a staff podiatrist for Therapeutic Alliance and Testing Center in Missouri City, Texas. She will soon enter her 31st year of the ladies of the Delta Sigma Theta
Mm-hmm.
Sorority Incorporated, initiated in the New York alumni chapter. So, my Delta friends in New York, your soror is
Mm-hmm.
on.
That's right.
She is now a member of the Houston alumni chapter, where she serves on the Social Action Committee. Lorraine, Dr. McKinney, welcome, my darling.
Thank you.
All right, we're moving and grooving. I don't think, Quentin, I received your bio. So, why don't you tell us about yourself,
No.
my brother? No. And you're
I
frozen
could have
on
swore
camera.
I sent it to you.
That's okay. I'm gonna let you
Am
introduce
I?
yourself. That's all right. You tell the people who you are, my brother. I know a little bit about you, but go for it.
Okay, well, I represent Phi Beta Sigma.
Woohoo!
I'm originally from New Orleans, Louisiana. I graduated from Xavier University of Louisiana, where I obtained my
HBCUs.
bachelor's degree in biology pre-med. From there, I went to New York College of Podiatric Medicine to receive my Doctor of Podiatric Medicine degree. I completed a 3-year residency in primary care as well as surgery at Gouverneur Hospital in New York City. After that, I went into teaching for 2 years in Yonkers, New York, where I was also a sports medicine doctor for the school district. After I relocated to Miami, started my private practice,
Hold
in
on,
which
y'all. He
now I've
said
been
Miami.
here, say,
He said
20.
Miami, correct? Miami. Everybody knows Dr. D grew up in
Correct.
Miami, so we have love for each other. Okay.
Yeah. For 22 years. And currently, well, ever since initially I was in just regular private practice in the office, but I hated the aspect of being stagnant. So I started treating more so of the patients that were in adult living facilities. Uh, Love it very, very, very much. In addition to that, recently, because I've always enjoyed the cosmetic aspect of beauty, I started going into the cosmetic aspect with sclerotherapy for treating spider veins, reticular veins, varicose veins. In addition to that, ventured out into scalp micropigmentation for the hair, as well as paramedical tattooing, in which you can treat basically any of the conditions that's on the skin, vitiligo, hiding scars, when women have mastectomies and get breast implants, they don't have an areola, anything like that. So I create all of those things. So I'm loving it, but I still love my field. I'm still doing podiatry in the first part of the day, and then in the afternoon, I take care of the paramedical tattooing aspect, and on the weekends.
Fantastic. And I'm a breast cancer survivor, so you know I love that. And we'll chat about that some more as well. My last guest is Dr.
Okay.
Brian Jones, and he is from South Carolina and
Mhm.
attended the University of South Carolina in Columbia, South
Yeah.
Carolina, earning his BS followed by earning his doctor of podiatric medicine from Barry University in Miami Shores, Florida. He completed his 3-year residency, darlings, at Yale, at the New Haven Health in New Haven, Connecticut. The Yale Department of Podiatric Surgery presented Dr. Jones with the prestigious Residency Excellence Award for his outstanding performance during his second and third year of training. He attended and presented the Northeast Region Podiatric Complications Conference. He is a associate for the Family Foot and Ankle Physicians in Greenville, North Carolina, and made partner last year. He has now become more involved in his community by giving lectures on diabetes at East Carolina University Medical Center and volunteers annually at the Joy Community Center. He enjoys music, spending time with his family and friends, and attending a host of events. He found love very shortly, and after moving to North Carolina, where he's been married and recently welcomed a beautiful baby girl. Welcome, Dr. Jones.
Thank you. Thank you. Glad to be here.
So, y'all, podiatry. I remember, and Darren, because Darren, I think Darren, you were a year or 2 years ahead of me. I can't remember now.
I was
remember
99, so
99?
probably, yeah.
Okay, so I'm class
1 year
of
behind
2000.
Quentin and Lorraine.
Yeah. So we were
probably-
2000. See, you giving out my business though. Everybody.
Oh, my bad.
But
All of our business.
I'm pulling it together, right? I'm keeping it together, ladies.
No, that's right.
But what I remember is that at one point at school, we had, I think we did like a Greek day, and we came out, we busted out with all of, we were like, yeah, okay? And it was amazing to see the Greeks that existed while we were in school. Unfortunately, we had a representative for the Sigma Gamma Rho Sorority Incorporated who couldn't make it this evening, and Kappa Alpha Psi, unfortunately, could not be represented this evening as well. But we have them in our hearts, and we thank you. And I see somebody who's representing the doubly and final woman of Zeta Phi Beta sorority, O2 Connect. We see you. Thank you. Thank you for logging in. So my questions, I'm going to first go to Kimberly. Kimberly, we're going to talk about sisters in podiatry. So we met on the lovely beach of the Inkwell. And if you don't know what the Inkwell is, that's when all the Black folks gather in Martha's Vineyard in August. It's insanity because we have the Pink Well, which the AKAs have done the largest amount of beautiful Black women on a beach. I think we're in the Guinness Book of World Records now for that. And Kimberly and I connected, and I was like, girl, you're podiatrist? Me too. And then as Black women do, we conversed. It was fabulous. And then later we were like, I know there's more Black women, like when we would attend events, as I'm sure my brothers and can say the same thing, as well as our sister Lorraine, where we'd go to events and we'd be one chocolate chip and a bowl of ice cream, you know, and be like, where is everybody? And I really hated that. And I said, I have, love for all my colleagues and friends, but it's nice to see people who look like you as well. So we decided to do Sisters in Podiatry, our focus Facebook group. Kimberly, tell us a little bit about that, and then tell us about what you do for Alpha Kappa Alpha. I know what you do because I'm doing it with you, but I wanted you to share it with the audience.
Yes, thank you again for having me. I think about that. I'm trying to remember what year did we start Sisters in Podiatry. I have to go back and look.
I think it was 2019.
2019, yeah, it was pre-pandemic. But yes, so it was as Sora Doc said, it was amazing to meet another podiatrist. As you all know, it's really, really interesting. You don't know what, the profession that someone has, and someone says podiatry. And if you listen to all the years that we've all graduated, we've been in this game for a while, but it wasn't a lot of us in podiatry. So we just immediately connected with that. And we knew that there had to be others out there on Facebook. Dr. Kradai is much more into social media than I am. She's on Instagram and all these other places. But we were able to start a group on Facebook, Sisters in Podiatry, and we're actually getting ready to kind of revamp the group and get more active with that, because we have a lot of women in the group. But it has just been wonderful to know that there are other sisters in podiatry across the country, and when someone asks for a recommendation of a podiatrist in a certain area, we're able to quickly, go to our group and ask, and we're able to connect patients like that, and also just connect socially. You know, if we're in, now I have others to connect, not sisters in podiatry, but others in Miami and other places. Now we know some other folks, but it's just been wonderful just to connect with other podiatrists, sisters in podiatry. And you also mentioned Pinkwell. I'm in the Boston chapter of Alpha Kappa Alpha, and we celebrated our 10th year. Pinkwell was in the inaugural gathering, and we have now trademarked Pinkwell. It was podiatrist, well, excuse me, not podiatrist, excuse me, AKAs. Now I got to different lanes,
AKA podiatry.
Right. So it was sorority sisters gathering at Inkwell, as Sora Doc said, and now it has gotten very, very large. Pinkwell is now trademarked, and other Greek groups are there that week, usually the third week in August, and it's a wonderful time. Everyone walks around with their sorority or fraternity shirts, their college shirts, and it's a beautiful time. So I've enjoyed the connection.
Thank you so much. My sister Lorraine of the Delta Sigma Theta Sorority Incorporated. Tell us about, first tell us, I should have asked Kimberly. So let me go back to Kimberly. Well, you said that you were initiated in what year?
1993.
Okay. So my dear Lorraine, Dr. McKinney,
Yeah.
tell us when you were initiated and tell us how podiatry, the things that we are all podiatrists, but giving back. I know Delta is making you work. Tell us what that looks like and tell us a little bit about Delta Sigma Theta if you can.
Yes. Actually, I was initiated spring of 1994 in the New York alumni chapter. So I was right in medical school in the middle of my initiation.
I admire you.
So it was like double initiation with medical school and with the sorority. But right now, like I'm working with the Houston alumni chapter in the social action committee, and I'm actually on a subcommittee working with health disparities. So that touched my heart as far as when it comes to diabetics and many of the patients that we treat. That we're dealing with those health disparities, really trying to help people to get the care that they need. Often they may not hear about care that they need and they're just not aware. So this outlet in providing awareness is like amazing, so that we're able to share just in real talk and just be able to reach out to as many people as possible, letting them know that they can come see a podiatrist, and we're here.
They look like you.
Here to serve, right? A podiatrist like me, and like everyone here on this call. Again, we're here to help, and we are reachable. We're real people who can really talk to them and help them.
Dr. Quentin Matthews, now I'm claiming him as my Miami brother because, I'm like, I'll be in Miami, I think possibly next month. We'll connect. And tell me first of all, when you were initiated, if you want to give us a little pearl about being a Sigma, and also let us know what you do so much, as we heard. What do you do for the community?
Okay, well, I was initiated in 2000. The Kappa Psi Sigma chapter in Iona. It was in my last year of my residency when I was the chief resident.
You guys are both admirable.
So it was quite interesting. It was quite interesting, but very good. Here, I'm a part of Gamma Gamma Sigma, the chapter here. We do a lot of events, fundraisers, Relay for Life, to raise money, a lot of health fairs in which, I sponsor the podiatry aspect, sharing information, testing people, and giving back as much as possible.
Thank you. Dr. Jones, since you are our newbie podiatrist,
Thank you.
And you finished your residency, and I know, listen, some of these aspirations here about I'm be initiated through residency and all that is amazing. And now that you have a new baby, which I know is taking your time, sometimes we put being active on hold to take care of our personal lives, rightfully so. But tell us about when you were initiated. Tell us any little pearls you want to give us about your fraternity, IOTA.
Certainly. So again, thank you for having me on. This is fantastic. first time doing something like this, but hey, I'll give it a shot. So yes, I was initiated across actually in 2011 across the IFIT at the University of South Carolina in Columbia. I was actually very active in the fraternity there with IOTA. We did a number of different events like Relay for Life for there. Adopt a Highway was really big for us. We love doing things like giving back to kids, doing up the such. And I really wanted to keep that momentum going. But I think, as we all know, once school, and again, I commend anybody who did this while doing residency or school. I mean,
Me
that's
too.
amazing.
It's
But
amazing.
yes, school and then residency and everything kind of took over my life a little bit there. So I will admit I did step back a little bit from the organization, and they were, very respectful and understanding with it. Of course, I think we all are. But after that, once I finished, because I mean, I feel so young on this panel because I just finished
Wait,
residency.
hold on. What you trying to say? What you trying to say, Brian?
I'm not implying anything. I think
Okay.
everyone up
I'm
here is
side eyeing
great.
you right now. I'm like,
Save myself
call
with
one
that
of your big
statement.
brothers or something. Okay.
Just a little inexperienced compared to other panelists here.
That's
I'll
the better
say
word. Experience.
there we go. Yes, I'm just lacking experience. But yes, I mean, right in the middle of the pandemic, I graduated from Yale in 2020. And with that, as we know, I kind of put my life on hold, to pursue career and getting back to it. Yes, I moved down. Things were, I mean, the world was kind of shut down at the time, but somebody made do. And then after that, it's ended up finding my now wife, and now we have a beautiful baby girl. She's 6 months now, and it takes a lot of time. Big adjustment.
Aw.
Big adjustment.
Congratulations.
Thank you.
Congratulations.
Congratulations.
Tracy Stokes, do create. I think I'm saying it correct. We see you from Slidell. Thank you for logging in.
She's a Southern grad.
That's right. Big brother Darren. So, I mean, I know your business, some of your business. Tell us when you were initiated, drop a pearl about Alpha and your contributions to the community.
So, unfortunately, I'm the old guy, right? Fall of 1987, pledged at Southern, which is the Epsilon chapter. And, so just to make Brian feel a little bit better, you're the young guy, I'm the old guy, okay? I don't mind being that guy. So anyway, for many, many, many years, and just most recently, I decided I was going to get more active with Alpha. So, I mean, not even a week ago, I started reaching out to the Pi Pi Lambda chapter here, letting them know I wanted to reactivate. I wanted to do community service through a better organization. And Tracy Stokes, who you just saw log in, she got me kind of involved with the Southern Alumni chapter of our, alumnus. And we did some scholarship stuff. I was a guest speaker, which was very hard for me to do. And she, so she was so gracious she made me feel like I did a good job, and she's very nice to do that. But anyway, we did a little scholarship banquet, gave some kids some money. So I just needed to figure out how to get back more into community and not just through me doing podiatry and giving patients good care and all. I just want to get back to the people who may not have access to me through my business and through podiatry. So I'm about to get really, really into it again with the Pi Pi Lambda chapter, which is here in Slidell. And we'll see how that goes, man. I'm looking forward to it.
Amazing. So I think it's so important that, being Black, being podiatrist, that's amazing because we have a small echelon where we are. I remember people have said to me, there's Black podiatrists, female podiatrists, and I'm like, we're here. But I think it's amazing when we're out in the community. It's one thing to practice wherever we're in hospitals, federally qualified health centers, your private practice, what have you. But it's another thing when people are seeing you up in your face and can ask you questions. And I know that what happens to us on the vineyard, I know what happens to me, Sore, but what happens to me is, hey, Sore, hey, doc, girl, let me show you my foot. My mama's hip hurt. I'm like, I don't do hips. Let me show you that. You think I should have surgery? Can I see you when I come back? Oh my God. And you don't realize it. And even though I always tease about it, it is a blessing that your community trusts you. I think it's a big blessing. Kimberly and I are also on the medical regional team, in which we are the subcommittee. She's been a chair before, and I'm subcommittee. And we have the pleasure of having different webinars that the notable North Atlantic region, under our Madam Regional Director, Alicia Piggy Spearman, Esquire, has been gracious to allow us to do with our CMO. And I love it. I love giving back, and I love educating people. I would ask you guys and say, what are the things that you think that we're in medicine and we know that it's a privilege sometimes to be able to move around in the ways that we do, whether it's in the surgical centers, the hospitals, what have you. What is the thing, if you were to, you're speaking to your, people now, what are the one thing that you would say that you like to impart when you speak or engage in the community that you think is something that they should know? And I'm going to throw that question first to Dr. McKinney.
I think the main thing that I share, especially when I'm at health fairs and I'm promoting diabetes awareness and diabetic foot care, I'll just tell people everyone with diabetes needs to see a podiatrist at least once a year. And that's my one line when someone's walking by my table or I'm trying to get their attention. That's what I like to leave with them. Inevitably, everybody knows at least usually one person or someone in their family who has diabetes. So that's what I try to leave with people or patients as well.
Dr. Jones,
jump in on that one. I just have to absolutely.
What would you say? I'm so sorry. What would you say as you get back active? Because we have to worry about baby girl right now. But in terms of when you, because she's important, okay. But in terms of talking to your community, because we are community-based doctors, regardless of how you practice. What are the things that you like to impart to the community when you see patients?
I would say one thing I really like to impart to my patients is
I can't hear. Not sure if they can hear me.
Can you hear me?
We can hear you.
Yes. Okay. So one of the things I like to really incorporate into the community is just the kind of piggyback on with the diabetes, but the importance of checking your feet and
everybody. I'm gonna take one break. I'm gonna pause in and pause out because I don't think anyone can hear. I can't hear you, and I want you to be able to hear me. So Brian, I'm gonna let you continue the question, and I'll be right back.
Okay. All right. So with that, it's pretty much the importance of making sure that you check your feet, because sometimes we overlook and forget how important our feet are. And it's actually ironic because I have a friend who is a hand specialist, and we would talk and we had a little banter back and forth of what do we use more? Do we use our hands more? Do we use our feet more? And his response was, well, of course we use our hands, because he likes to talk with his hands. And my rebuttal was, I said, well, the entire time we were having this discussion, you were standing the whole time, so using your feet. So stuff like that you can't forget. He kind of saw things my way a little bit later after that. But yes, knowing the not forgetting the importance of checking your feet and being mindful, I would say, is one thing I would really push for my patients in the community.
So our doc didn't hear me when I was trying to chime in again, also with both docs have said, but working in 2 federally funded clinics, I see lots of diabetic patients. And today I was in one of my clinics, and it's so surprising, I'm sure you all know, to see a patient come in as a new patient with a hemoglobin A1C of 14.
Yeah.
To our audience out there, that is a blood test over 3 months that shows your blood glucose.
Mm-hmm.
And the first patient of the day told me that she was having burning and tingling in her feet. Going to her lab work, she has a A1C of 14.7. So not only are we treating problems of the foot, but then I had to go into my 30-minute initial patient visit of talking about diabetes and her diet, and as we know, inspecting her feet and all this. And it's surprising sometimes, because having done this for so long, it's surprising when people act like they've never heard it before, and some have not. And she was actually, the patient that I was speaking of this morning was actually didn't even know that her 14.1 hemoglobin A1C has a lot to do with the burning and tingling that she came in to see me for. So I absolutely emphasize, there's so many things that we treat, so many things that we do, but that is something that I absolutely say if we know someone's diabetic or they have a family, member or friend or what have you that's diabetic, let's get them in to be seen.
Sounds amazing. I'm back.
Yes. Okay.
I know Kimberly, you spoke. I believe Lorraine spoke.
I
Who am I
did.
missing?
Quentin.
Quentin, Miami. That's his new nickname.
Yeah.
Tell us about what you think is important to the community.
Well, the one thing that I stress in addition to the diabetes is about neuropathy. I'm always stressing to everyone that you could be walking and have no idea because you can't feel. You may have a hole in the bottom of your foot, in which basically, if you get an infection and it affects the bone, leads to amputation. So, as what Dr. Brian said, in terms of walking, our goal is to keep everyone walking. You take for granted that, say, for instance, you want to go to the kitchen to get something to eat. How are you going to get there if you can't walk? Going to the bathroom. Can't get there if you can't walk.
That's right.
That's
So
right.
that's my main thing that I stress to everyone. It's neuropathy.
I feel like we were in church. We were like, praise the
Right.
Lord.
Exactly.
I'm like, that's all we had to do is praise him. Oh my goodness. I would say for myself, one of the things I like is you have a voice, you have the right to be understood. And if you don't understand when you leave, then you didn't have a visit. Your patients, my patients, I'll speak for myself, should be able to come in, get great information. I'm bilingual, so I speak Spanish and English, and be like, I understood what you wanted. I can go and do this. If you don't understand, then you didn't get a visit. Somebody just spoke to you, and it's like, what do you call it? Snoopy, wah, 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 and you have no idea what's going on. I think literature is important to back up whatever you do. I think that's like, because sometimes, it takes folks a little longer. And I think having social media, I know Kimberly makes fun of me, Dr. Thurman, I'm the queen of it, but I think it's amazing where people can go on, like right now, and they're seeing us and can ask questions.
Right.
And while I'm saying that, I'm giving a shout out to Kat, we see you. I'm giving a shout out to Michelle Reynolds West from New Jersey. I see you. Miss Katern, I think I'm saying that right, is Azeta from New York. We love it. And she works at Neighborhood Health. I know who that is. Thank you, Keisha Turner. We appreciate you. Z love for you as well. So, another question I'd like to ask is, surgery. And a lot of people are like, oh, sometimes when they hear surgery, my cousin said that, he lost his big toe. And I know black people, we love to do that. My mama said, and I'm like, what did you say? Unless the doctor said it, let's see. And surgery is sometimes necessary. And the things that I will start off first and say, being a black woman, I'm very, 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 very anal about scarring. And I like my patients to look good. I'm published for my medial lateral incisions for hammertoe surgery. And I also have had the pleasure of, working under Dr. Lowell Scott Weil. So he knows that I love the medial and lateral incisions. But I think that surgery is important, that you can go to any great surgeon, many of our colleagues are, but I think it's amazing when I can send a colleague to someone who looks like us. And best yet, if in their D9. So tell me, I'll start with Darren. Tell
Yeah.
me if you're doing surgery, because not everyone is,
hmm
and what one little pearl you'd like to impart in your patients who need surgery from you.
So I do. Obviously, you went to the Treese Medical seminars and workshops, I'm sure, in the past.
Mhm.
Been doing the Lapiplasty ever since it came out. That's my go-to bunionectomy. I try to do as little of an incision as I can to make it look good. Obviously, I do have the discussion with anybody with melanin in their skin about the possibility of keloids. So
Mhm.
one of the things we just incorporated in our practice, and we all, the guys in my group, being spine surgery, we have orthopedists in the group. I have um, interventional pain guys, and we're all, whatever, who is ever doing an incision, now we're trying to push these collagen bandages to at least minimize scarring, because sometimes you'll do a great bunion surgery, it has this huge IM angle, which of course we know
Okay, you wait.
uh,
You used a
Exactly,
big
but we know what we're
word.
talking about, but they don't, right?
What?
But
I don't know
what
what an
they see is
IM
a
angle
scar.
is. What's that?
Well, the bunion. So the bigger the IM, the bigger the bunion. We know this. But what I was going to say is the patients won't care about that. They will want to look down at their foot and see improvement of their symptoms, whether it was a bunion, and they want to look down. And when they see a scar, they're not happy with it. So we try to minimize scarring as well. So we really just started to incorporate some collagens and some post-op dressings that will minimize scarring.
Sounds great. Lorraine, do you do surgery, and what pearl would you, Dr. McKinney, impart to your patients?
Right now I'm at this. Dr. Jones actually mentioned that he feels young, and I have actually chosen not to do surgery at this point in my career, just personal choice. However,
Absolutely.
I see a lot of patients that have questions about surgery. So because I have done it in the past, I'm able to educate them on the best practice or just things that they can talk to the doctors that I do refer to regarding surgery. But I try to tell the patient, especially if I think that they're not the best surgical candidate, I just try to help them with all the questions and answers and things that they can use, the information they can use so they can get the most out of their experience. But even though, I just try to encourage the patient to think very carefully about it and understand that surgery on the foot, usually in a lot of cases, it's elective, but that pain is the number one indication for surgery when it comes to our bunions and things like that. So I really try to, some people will come and they're like, I don't like the way it looks. And I really try to educate them on the, pain is the number one indication for surgery.
Sounds great. Brian, since you said we're going to tease you now, the young buck on the
Okay
group.
with
And
that.
hold on, people from Yale, darlings, from
Oh my
Yale.
gosh.
Tell us about, we got jokes. So, but that's amazing. Honestly, what pearl, well, we know you do surgery, clearly. What pearls do you impart on your patients, particularly of color?
Oof. Okay. So and this is not necessarily recent, but definitely something I harp for my surgical candidates and patients such as that, especially those of color, is expectations when it comes to the post-op period. Uh, Dr. McKinney did mention, you want to have a good idea and knowing, who's a good surgical candidate, who's not. These are, of course, things you want to keep in mind, but you really want to have that discussion with the patient and letting them know, listen, these are expectations, and this is a big thing. I'm sure we all have gotten it. Doc, when can I start driving? When can I start, putting weight on my foot? Things such as that nature. And I have to remind them, listen, we talked about it. These are expectations. These are things that you really have to consider to get the best outcome. Because and I like to tell my patients, when it comes to the recovery, you want to do it once and you want to do it right.
That's
So
right.
yeah, we don't want to
Don't act up and call us on an
Yes.
emergency phone after hours because you decided you need to go to the mall because there
That's
was a
right.
sale. Don't do that. We
Yeah.
love you, but don't do that.
It happens. It definitely happens. They'll make a decision, and
They're making
this is
decisions.
that. So definitely the importance of knowing, and when it comes to that, particularly my patients of color, they have a tendency, as you said before, when you said your grandmother says this and that. In the South, especially here in Eastern North Carolina, we have a tendency to rely heavily on home remedies and what such and such said
Don't worry,
generations.
West Indian people do it, the Africans do it, the Latinos do it. I hear it all.
It runs deep here. So I do have to remind them. I was like, you know what? No disrespect to your ancestors and whoever said what. But if you could follow this protocol, I think we'll work out a little bit better.
Absolutely. Absolutely. Dr. Matthews, I know in Miami, everybody's trying to be cute. So what do you impart? A, do you do surgery? And B, what do you impart in your surgical patients?
Yes, I do surgery, but only in a case of that it's really necessary. Um, Dr. Jones took the words out of my mouth. It's post-op, always
Yes.
post-op. Those are always the problems. So I'm always stressing, make sure you follow my instructions, but you can only do what you can do. It's up to them if they want to follow the instructions. But in addition to that, as Dr. McKinney said, basically making sure that they legitimately are a surgical candidate, a good surgical candidate. in Miami, as you know, cosmetic wise, you have people that just want to come in and say, oh, I have this little thing or whatever, can you just do a little cosmetic thing? No, it doesn't work like that.
I can
So,
imagine in Miami.
I would, yeah, I would stress that it's basically post-op and making sure that it's legitimate candidate for surgery.
Sounds great. Dr. Thurman, do you do surgery? And if so, and even if you don't, what pearls do you impart?
I think like Dr. McKinney at this point in my career. Of
Because we're
course, I work.
seasoned. That's the word that we're trying to
Yes,
teach Dr. Jones.
seasoned. That's it.
Yeah, thank you for that. I did, the very beginning of my career, and then of the last few years, I'll just say, and we're talking about podiatry, and hopefully we have some young folks who are listening. It has been a wonderful career to have a family and some other things. So I've been able to work in some clinics and do wound care. And I just, at this point, I'm not doing any surgery. Having said that, we do nail surgeries and some other things and seeing patients. And again, it's just a matter of making sure our patients understand what they're supposed to be doing at home.
Mm-hmm.
You can almost see it when they come in and you've done a permanent nail removal or whatever the case may be. And you ask them about, how's it been? And you can almost see on their face. The wound shows the difference too, but you can see on their face that they haven't been following instructions. So I'm a big proponent of written instructions and repeating myself over and over and over
and over
and over
and over.
Because you go through this time for whatever you're doing. We don't want to prolong the time of healing, and we don't want complications. So
absolutely.
Yeah.
Absolutely.
And another thing I would say that you said you're bilingual. That's fantastic. I have to use a interpreter for one of my clinics that I'm in just about every other patient. And as you know, that takes a lot longer, but I take time to make sure that they understand everything that I'm saying, because I think about the fact that if you're someone who's, not speaking the language that you're speaking and someone's trying to explain something to you, and you may be nervous about that condition or whatever, and you feel like you're not understanding, you can see the frustration on the patient's face. So
absolutely.
Making sure that our community and other communities that feel marginalized have good care. And I'm sure all of us on this call have been, you can almost see the relief sometimes when a patient walks in and they see you and they feel like there's some connection from, even if it's skin tone or gender or what have you. That's very, very important. All these studies talk about how sometimes patients aren't getting good care because of some racial disparities. So
exactly, healthcare disparities are real.
Yes, sir.
And I do surgery, fractures, bunions, like Dr. VG. I do, it depends on the patient, but I definitely do 3D bunionectomies. Trees Medical, they were on our show in the past. We thank them. So I'm versed in, I don't do as much as I used to do, and that's because I'm seasoned, Dr. Jones, but I definitely still do surgeries. And I work with residents, which I enjoy. I love, I have one hospital now that has 2 new Black female residents, and I was super excited to see that. And I just love working with, the younger folks, because I like teaching. And, if I can impart some wisdom on you, I also ask during my surgeries to my residents, what did you learn that you liked, didn't like, and what could be better? Because that makes me a better doctor, both for technique and even for empathy with my patients. So I think that if a doctor can't critique his or her own work, you're getting too big for your britches, as they like to say, because you should be able to do so. There's a shout out to Dr. Jones from Family Foot and Ankle Physicians. They're saying hello to you, and we say hello back. So someone asked a question about pedicures, and I'm gonna give it to my sisters. One, because we're women. Two, because you're more in office and doing surgical procedures out of the office. So everybody want to be cute. I know when we're in the vineyard, people to go, hey, Dr. Dakota, hey, Doc, hey, Soren, they look down because they want to see. And my stuff is together. I'm coordinated from head to toe. You know that, right? So questions about pedicures. A lot of people ask, should you do a pedicure? Can you do a pedicure? I'm going to put one little small response and I'll give it to you too. Diabetics, I know in the tri state, there's signature information that says if you're a diabetic, please indicate to us that you are, because nothing sharp, as we know, a blade, the little peg egg thing that people like to use,
Mm.
should go to the foot. A lot of times people don't read it, or people don't know they should indicate it, or they simply don't want to because they are, oh, I got this bad callus. Tell us about pedicures. What would you say to women and men? Because men are, following their significant others for pedicures these days, and the massage and all the things that we enjoy. Dr. McKinney, what would you say about pedicures?
I've been telling patients to be very careful. So I don't want to totally discourage them, but I just urge them to be careful, make sure they're very aware of their salon and who's actually doing they're providing that service. And often I'll ask, especially if I know it's a patient who is diabetic, I'll say, does the person that do your pedicures, do they know that you have diabetes? And often they'll say no. And I'm like, oh, and then I educate them on that. It's just really dangerous, because what happens if you're cut, or who knows what they're using on your feet. So I just really urge them to be careful.
I agree. Dr. Thurman?
I absolutely agree with everything that Sir McKinney said. I also say that your nail shape does not need to be changed by the pedicurist.
Goodness,
The
yes.
instruments need to be
Wait,
sterile.
but I want coffin nails to match my
No.
coffin nails. What's
Oh,
up, Dr.
And
Thurman?
then they
What's
come
up?
in
no.
to us with the ingrown toenails that
Yes.
with the splinters, the spicules, or what have you.
Mhm.
So not only should your instruments be coming out of sterilized packs,
Mhm.
they don't need to trim all the skin around the nail.
Right.
We get the
Yes.
bacterial infections
Mhm.
that happen so often. And what I really tell patients, even if they're healthy and got good pulses and things like that, is it's nothing wrong with the place if it's clean, but just let them file your nails. Let them file, and you want the polish, because the polish is the thing that the ladies are doing, because it lasts 2 or 3 weeks, but they don't need to change the shape of your nail.
I did a presentation for a couple of groups recently on gel pedicures. And I was telling them, I said, your toenail polish don't need to last 3 weeks. That's not breathable. It encourages fungus. There's Keriflex, which I think all of us know about, which is an FDA product that you can use over your nail. And I know when people are, oh, that nail is ugly and raggedy. Well, come see your podiatrist to treat it. But a lot of podiatrists are offering Keriflex to give you some temporary cosmetic cover, which is approved and doesn't give all the things like an acrylic nail, which can turn your nails green. It can turn your nails fungal. It can cause ingrown toenails. So I would say that. And now I'm going to shoot to the brothers. So, brothers, Black men, I love when there's always a stigma in our society that Black men do not like going to the doctor. And I get a lot of my friends' husbands and boyfriends, and because you know what? I look like I can be their sister, and they treat me as such, and I appreciate it. And I know Black women love seeing Black men too, because you are our brothers. So I'll start with Dr. Viji. Being a Black male podiatrist and an alpha, what is the one thing that you would say to encourage patients to see you?
Well, just to use all of the examples we've been talking about, the loss of limbs, the loss of digits, the infected wounds, and all the things that can go wrong if you don't come on a regular basis to, have a evaluation every 3 to 6 months or once a year. So when I meet a guy who comes in because the primary care doctors in this area are very well versed on what needs to be done, they're sending them. So that's a good thing. But when I do get the males, I do encourage them not to be the male, because men, we like ego, and I always discuss ego with them. And sometimes I tell them, if our egos are going to tell us to do the wrong thing all of the time. So tell them to suppress the ego, swallow it, and come in. Don't have so much pride, and that's going to save you and your feet for quite a long time.
Absolutely.
Mhm.
Dr. Matthews, what would you say?
Oh, well, primarily most of my patients are the elderly, because I'm more so in assisted living facilities. So I don't have that many problems. One advantage I would say that I have is they tend to be tougher on women, giving them a hard time in terms of treatment, the nurses, the doctors, and so forth. But when I walk in, it's a whole different story. They do whatever I want them to do. They accept the treatment. They love it. So in that aspect, I don't have any issues. Basically, everyone's open and receptive, listening, following directions, and they actually look forward to seeing me.
Fantastic. Dr. Jones, same question.
So in my patient population, I like to stress to the men that you do not have to wait for your wife to drag you in. So as your feet matter too. All right. I'm sure you do long hours and they can use a little bit of attention. So, and they certainly do when I see them. So I like to stress to them the importance of your feet matter too. This is not a stigma or anything that you have to be worried about. Like, I agree 100%. Put your ego away. I really do. And when you do that, so much more comes out more on the other side that will really be beneficial for you.
Absolutely. Yes, I see our sorority sister, Shamika Rhymes, representing the Alpha Kappa Alpha Sorority Incorporated. And we are so pleased to have you. So I'm going to ask one question before we wind down, because at the end, I love all of these doctors to be able to present where you can find them, both in their offices, on social media, and what's going on with Talks with Dr. D, which is one of the pillars that we're doing tonight, is stepping forward with Dr. D. So the question is, plantar fasciitis, which is heel pain, are insoles or orthotics, as we call them, effective? And I'm going to just ask two of you for time's sake, and keep it to a minute if you can. And I will ask Dr. McKinney first. Are heel pain, do inserts work?
They do work. It's just that people should really come in and see a podiatrist so that we can actually look at their feet and help them to find the right inserts before they spend all their money buying everything over the counter. It's really best to come on in and see a professional so we can actually tell them exactly what type of insert they need.
Absolutely. Dr. VG?
Well, and I'm not an advocate of the commercials that we see on TV. I'm not going to say the name, but I get that a lot.
Right, it rhymes with Dr. Oles.
Yes,
Right.
that one, right? And so what I tell patients is save your money, because what we're going to do for you with an insole is, one, we're going to maintain the proper alignment of your foot, and it's going to be custom to your foot, not 50% of America who might do well with the non-custom insole. So what I tell them there is, let's get you out of pain, and a lot of times we'll use the insole to maintain that relief.
Sounds good. And there's a last question. Since Dr. Quentin Matheson's Fabulous Miami, I'll ask him this. Someone asked, and I'll chime in. Would it be safer if persons brought their own nail kits to the nail salon for a manicure or pedicure? Quentin?
I would say yes. As long as it's, if there's a way for them to do some type of sterilization with the equipment, I think it's better. Because then you don't risk getting infections, making sure that you're getting the correct care. It's not being shared amongst amongst others. So my answer to that would be yes, it's better.
Wonderful. I say the same thing. I tell everyone, if you can soak your instrumentation in alcohol for 10 minutes minimally, and then let it dry, that's a great way to help with cleanliness. Even better if the nail salon, a lot of times the better nail salons will let you keep your own kit there, and they'll sterilize it for you. So yes to that question, because everybody's trying to be cute in these streets. And, this is the best time to see your podiatrist if you have nail fungus and what have you. A lot of times, whatever treatment you decide, the nail can take 6 to 9 months to grow out. And people want Jesus to lay hands. And we say, we are not Jesus Christ. We are your podiatrist. So therefore, if you're having any nail issues, this is a perfect time. Especially in the north, you are in socks and Uggs, okay? Get it treated. Don't come May talking about, hey, doc, because I'm going to be like, hey, back, and not have a great answer for you at that point. So I love that we had this conversation. I love seeing professional Black folks doing their thing. It's fantastic. So what I'm going to ask is for everyone, I'm going to go in order. I don't know what order I'm going to go in, but I'll figure it out in a second. And I want you to say your name, say your organization, say where we can find you, where you practice, and where we can find you on social media. And we're going to keep it short, 30 seconds or less. So let us start with our junior, since I'm teasing him, Dr. Brian Jones. Please begin.
All right. So again, Dr. Brian Jones, a member of Iota Phi Theta Fraternity Incorporated. And with that, you can actually find me at Family Foot and Ankle Physicians, located in Greenville, North Carolina, the Eastern North Carolina region. And surprisingly enough, I actually do not have any social media.
I am impressed with myself then. Okay.
Yes.
Okay.
Yes, you can find me there. We have our website at Family Foot and Ankle Physicians. Please come on down. We treat everything from total nail erosions to any reconstructive procedures. We'll be happy to see you.
Thank you. Dr. Quentin Matthews, 30 seconds or less.
Hello, I'm Dr. Quentin Matthews. I practice in Miami. I'm a member of Phi Beta Sigma. You can find me at goldentouchdoc.com, as well as just look up House Call Doctors of Florida. If you have any family members that may be in any facilities or at home, I could take care of them. As well as I said before, if you have any conditions that you may need the paramedical tattooing or scalp micropigmentation, or in the cosmetic aspect of the sclerotherapy, I'm here for you.
Amazing. Dr. Lorraine McKinney, 30 seconds or less.
Yes, I'm Dr. Lorraine McKinney. I'm in Houston, Texas. I'm of course, a member of Delta Sigma Theta Sorority Incorporated. You can find me at Therapeutic Alliance and Testing Center, located in Missouri City. Our website is www.treatmentwithtatc.com. We're also on social media. And also you can find me at Lorraine E. McKinney, DPM, PLLC on Facebook.
Fantastic. Dr. Kimberly Thurman, my co-administrator for Sisters in Podiatry, and a pink well. 30 seconds or less, please.
Yes, I'm Dr. Kimberly Thurman, a member of Alpha Kappa Alpha Sorority Incorporated. I'm in Boston, Massachusetts. I'm actually in 2 community health centers. So I'm at Fenway Community Health Center and Dimmitt Community Health Center. I don't necessarily have social media that way because you can find me through those clinics. But if we have some sisters out there in podiatry, you can certainly join our Facebook group. It's called Sisters in Podiatry, and I'm a co-founder with Dr. Kerdai. Thank you for having me.
Thank you. Dr. Darren VG, 30 seconds or less. Where can we find you?
Okay, Darren VG. And in my introduction, you mentioned Bayou Foot Care. That was my initial do-it-yourself thing. I founded, and that's my baby. But I've since joined Paradigm Health Systems, which is a multi-specialty group here in Slidell. Paradigm is, like, again, that's where you can find me, on the Paradigm Health Systems website. And hey, 487 Alpha Phi Alpha, go black and go.
All
And
right.
you know, while our saying this, and I say it to all of my Alpha friends, first of all, we're servants of all, and that's where we can start.
Sounds amazing. My name is Dr. Kordai Decoto, and I'm the founder of Talks with Dr. D, a 3-pillared approach, which we have Stepping Forward with Dr. D, which you see the first Wednesday of every month, with the exception of this month because it was New Year's, where we talk about all things of the lower extremity for blackdoctor.org. And also Sisters on the Vineyard, which is coming back August 12th to the lovely Martha's Vineyard, where we have board certified physicians. We had JP Morgan last year getting our wealth on point. And we also have our celebrities who come to speak. Last year, our sorority sister, Sunny Hostin, and also Sigma brother, Malik Yoba. This year, it's a surprise of who it's going to be, but you're going to want to come. It's HBCU week. We also have Talks for Dr. D Breast Cancer, which you can see me on multiple platforms speaking on surviving breast cancer, the journey of breast cancer, advocacy, and empowerment. And you can find me in all things that Talks with Dr. D on Instagram, LinkedIn, Facebook, and my website, talkswithdrd.com. It has been my pleasure to have these fabulous podiatrists on. Everybody throw up your sign because we show them what we're working with. Hello. And we look forward to next month. The first Wednesday of the month at 7 o'clock is Women's History Month. And we're going to have some fabulous dynamic speakers on. With that, we bid you adieu. Thank you. Bye-bye. Wave them out.